Thank you very much. Good afternoon, everyone. And I apologize for changing the time of this update. As you know, Dr. Moore made an announcement at 11, so I didn't want to coincide with that. So I just wanted to give you a bit of an update now. I've got the announcements were made, so I want to talk a bit about them as well because I know I've already received questions from some media. So let's get going with sort of a usual review of our cases and where we are provincially as well. Before I start talking about some of the changes, I know that just trying to get my local statistics here. There we go. I'm going to. There we go. Jen, I just want to make sure you can see my screen. I'm on local stats and updates.
Yes, we can.
Thank you. Just want to make sure. Sometimes I miss that. Okay, so again, our hospitalizations as of today were 3. None in the ICU, and that's a real decrease of what we had before. Positivity as well. Outbreaks are now to 2, and our deaths. It seems to be that we've added 1 death. I'm going to verify, but I was doing some analysis of these deaths, and unfortunately, most of them were in individuals who were in their 70s, 80s, and 90s. Again, most of the individuals were not fully vaccinated. That's the problem as well. But again, it just shows that we need to be moving forward, cognizant of the fact that our seniors are still most vulnerable as we move forward in sort of the new phase of the pandemic. So I just want to go over some of the trends here. Positivity, you can see, has kind of gone down. We're now sort of plateaued around between 9 and 10%. It's much less than it was. It was like over 30% about a month and a half ago. If we're looking at our institutional outbreaks, again, you can kind of see a very nice downward trend. We had a sort of an uptick of 2 here, but you could see again much lower than we had in beginning of February. Looking at hospitalizations, them too again are down. You can see sort of we're downward trend, and our ICUs are 0 now, which is good news. And so again, those are the trends that we want to look at. Wastewater is a bit of a dilemma here. I'm seeing some ups and downs in Castlemaine. I've got to look at that and speak technically about that. But overall, we're kind of leveling off a bit of a uptick in Hawkesbury, but the sort of a stabilization in Cornwall. But again, we're looking at with a grain of salt as well, just in addition to all of our other indicators. And the other one is obviously vaccines administered. I will go to another slide just to give you a bit more detail when it comes to that. So just kind of switch my slides here and go to my PowerPoint. There we are. I'll share again. So right now we're at 88% of our 5+ that have had first dose and 84% second dose. If you're looking at 12+, we're in the 90s, mid 90s for first dose and low 90s for second dose. Certainly for adults, it's higher. Our third dose is at almost 60%, 59.3%. It's kind of been staggering there, stagnant there. And if we're looking at our age groups, again, the elderly are higher. Still like to see them as high as possible, particularly our 50 and above. Our 60 to 69 are almost at 80%. Our 70 to 79 are almost at 90%, and our 80+ are over 92%, which is great. So I'd really like to see, particularly in that age group, a much higher uptake. We're continuing to offer it at all our clinics. Our demand has decreased, but we're still offering it to and encouraging people, if they haven't done so, to get their third doses. We're still looking at about 50% of our kids, 5 to 11, who have got their first dose, and about 25%, 25% who have got their second dose. And we're now looking at our 12 to 17-year-olds, and so far it's 6.1% that have received third dose. So we need to encourage that, move forward as we prepare for this next phase. Important to base it, and I've said time and time again, base it on a good foundation of immunity in the community. If we're looking at cases across Ontario, you could see that we had this big peak in January and it's going down. For the most part, all of Ontario is going in the right direction, even including the northern health units that peaked higher but now are on the way down. Algoma seems to have peaked and kind of teetered off. but again, we're seeing an overall trend in that good direction. If you're looking at our wastewater, again, this is provincial, and you could see Ontario is just flattening down a bit, so there's no peak. Where east is really on its way down cumulatively, and when I say east, we're talking about everything east of Scarborough to our health unit area. You can see Toronto has flattened out nicely as well, but again, the Northwest in particular had a big surge and is now starting to plateau. So again, we are keeping an eye on those indirect measures as we move forward. Positivity trends as well have decreased in these health units, including ours, and they kind of stabilized or a bit higher among the others. So we're seeing a bit of increased positivity, increased numbers, but again, they're decoupled so far from hospitalization increases or ICU admissions, which are going down. So I think those are the parameters that the ministry was using in order for us to, go into January 31st, where we had 50% capacity. Then in February, it went to 100% capacity to some of those restaurants, still with capping some of the large venues. And then, last week we went to 100% and dropped the vaccine mandate. And so we are expecting to see ups and downs of cases again, as long as they do not, interfere or cause severe illness, and our hospitalizations are going down. That's what we're going to be tolerating as we move forward. It's that decoupling that we're looking at. So having said that, and based on all of these parameters, as you know, the next big step to removing restrictions was looking at some of the mandatory vaccination policies that were implemented through a Directive 6, a letter of instruction by the ministry. And so to the Ministry of Children, Community Services, Ministry of Seniors, Ministry of Education, and Ministry of Long-Term Care. And so on March 14th, those will be revoked, and they will become the guidance instead of orders. So those will be removed. On March 21st is something that we were waiting on a decision on, that will mark the removal of masking requirements in most places, including schools, except in public transport, in transit, in long-term care, retirement homes, and other healthcare settings, congregate care settings, shelters, jails, and congregate care living settings, including homes for individuals with disabilities. So basically, it's the projection that we had sort of thought would occur, that masking would be removed in lower risk areas first and kept in the higher risk areas. Important to note that, again, as of March 21st, they're also lifting other measures in schools, including cohorting and daily on-site screening. We just got a memo that I hadn't had time to read, but very quickly, it still maintains the HEPA filters, ventilation, passive screening, hand washing, disinfection, those type of things in place. And all, as of March 21st, all other measures, regulatory measures and requirements for businesses, including passive screening and safety plans, which included masking, will be removed as well. The Reopening Act expires March 28th. They will let that expire. And on April 27th, the plan is that the remainder of the requirements in the remaining settings will be removed. Obviously, there's going to be ongoing support, ongoing examination, ongoing provision of PPE, ongoing provision of our rapid antigen tests, and so on. And so that's going to continue way beyond the 27th, obviously, because we're not out of the pandemic. We're now in another place in the pandemic here in Ontario, but we're still worldwide in a pandemic. And so we're going to be making sure that through surveillance and others, and again, keeping track of what's going on among our most vulnerable and in our healthcare system in that situation. That's what we're going to be monitoring moving forward, even beyond April 27th, obviously, because we do expect an increase in respiratory illnesses in the fall. As we close in, flu is going to come back. Don't forget, removing all these restrictions, all the viruses are going to be circulating, RSV, cold viruses, different types of coronaviruses, and so on. And we do expect perhaps a resurgence of a COVID-19 as well. And that's why we're looking at the questions of boosters and so on. So all these things are going to be there. They're going to be kept in place, hoping that we can maintain an open society, minimize hospitalizations, minimize deaths, minimize severe disease, while at the same time keeping an eye on any changes that may occur locally or internationally that have an effect on us. The other thing that's changed as well is going to be our case and contact management and isolation. So as you know, for now, if you have happened to be a contact, a non-household contact with an individual who has COVID, if you're fully vaccinated, you don't need to isolate. If you're unvaccinated or have underlying medical immunocompromising conditions, then you need to isolate yourself. Individuals who have tested positive in 90 days were exempt from isolation. Now there's a new guidance that really says no isolation requirements for any groups. No isolation. However, for 10 days after exposure, what you would need is self-monitor your symptoms, wear a mask, and avoid activities where removal would be necessary. Don't visit anybody who is a high risk, and not visit or attend high-risk settings. So those are the things that you should be doing. If again, it's a non-household contact. If it's a household contact, let's say it's your child or a sibling or a parent that has had COVID, right now all household members need to self-isolate, but now there's going to be a bit of a difference. So basically the following household members do not need to self-isolate, but should follow the above precautions like self-monitoring, don't visit people, wear masks and so on for 10 days. And that includes household members that have been tested positive in the last 90 days for COVID-19. It also includes household members who are adults, 18 plus, that have received 3 doses that are boosted, and household members of children less than 18 years of age who have been fully vaccinated, two doses. If you're not vaccinated, then if you're a household member, then you need to self-isolate for 10 days. And that is the bottom line. So we're going to be really working hand in hand with our community partners, businesses, and so on, trying to provide information, support them. I know that there is a worry among people. Some people say it's too fast. Some people say it's not fast enough in terms of removing the masks. I can tell you that my personal opinion would have been, I like the progression that was done. I like the fact that when we had the the January 31st, all that progression was good. I was just hoping that we would get another extra couple of weeks of masking, because next week, as you know, we're going to spring break, and then boom, when they come back the 21st, everything's off. And so I think the school boards needed a bit of time to prepare. People needed a bit of time to prepare. We also would need a couple of weeks just to assess what happens after spring break, because we typically get surges of cases after a school break. And so, and also it would be nicer weather. So I was hoping that it would be another 2 weeks. But again, the progression is the one that I think is a logical one. And at this point, our levels are low, and we're just going to keep an eye on things. And if people want to wear a mask beyond 21st, it's their right. If in fact, if people are high risk or vulnerable, or are not comfortable, they should wear a mask, and it's not going to be imposed. It's going to be an optional approach, and people will make up their minds. There will be a period of what I call kind of a crossover, because we've been sort of masked for 2 years and really locked down, and it's going to be a period of getting used to the new form of normalcy that we're going to be reverting back to. So I would expect different reactions from different people. I just want to say in English that before I go to questions, and I'll repeat it in French, that because everything is coming down, this will be my last weekly media update. Obviously, we'll be keeping media up to date and do any urgent ones that are required. Avant que vous pouvez me poser les questions. Je vais juste annoncer que ma dernière conférence de presse quotidienne, il n'y a pas beaucoup de choses à rapporter, sauf, c'est sûr et certain que si on a des choses d'urgence ou de nouveautés, on va faire une conférence de presse. Donc, merci. Jenna, I'm ready for questions.
Thank you, Dr. Paul. Merci. First question comes from Guy Kenville, CBC Ottawa. Please go ahead.
You're muted.
Bonjour, est-ce que tu peux m'entendre?
Oui.
Hi, thanks for doing this. I just a quick note, as someone who was born and raised in Cornwall and got to make a rare visit to the community this weekend, I was saddened to see that the Buns Master next door to the health unit office looks like it's been long closed. Very sad.
It's been a while.
So when this the same sort of debate came up, a couple of weeks ago when it came to vaccine passports and that mandate dropping, Dr. Vera Etches with Ottawa Public Health talked about how local medical health officers wouldn't have the ability to reimpose that condition locally if they wanted to. And I'm just wondering, when it comes to masking, let's say you saw the health indicators in the Eastern Ontario Health Unit trickle up to a dangerous extent, and you felt it was necessary, or you would like to see masking reinstituted in your backyard, would you actually be able to do it, or would you not have the power to do that? I'm hoping you can clarify.
A good question. There are two ways that we could issue orders. The traditional way is what's called the Section 22 order, based on the Health Protection and Promotion Act. And that remains. We still have an ability to do that. So for example, I have the powers to close a restaurant down or those type of things. And that's under the Health Protection and Promotion Act. The letters of instruction about vaccines and so on were the ones that we're not able to do anymore because it's part of the Reopening Act of Ontario, and that will expire. So we will still have capabilities to issue Section 22s at the local level.
And just to absolutely clarify, that would include matters such as masking, correct?
Yes, that would include that as well. But again, at this point, I don't see any need for it. But we're always looking out for that. Again, we would prefer something to be provincial because it's easier to implement. But again, we still have the Health Protection and Promotion Act has not been changed.
And just as my follow-up, can you expand a little bit more on why you felt a couple more weeks of masking might have been better to stick with instead of what's happening?
A couple of reasons. Number one, it gives a bit more time for schools. I think for schools to get ready. They're going to have a spring break next week and just go back to everything changed, almost normal. So they needed a bit of time. They only have 2 days, tomorrow and Friday, then they're off next week. That's one reason. The other reason was that we always get a bit of a increase in cases after kids are off school. And so it would have given us another week or two just the closer we get to springtime, the more ventilation, the more open windows, the more outside we'll get, and the less the chance of a virus to propagate.
Merci.
No problem.
Next question, Hugo Rodriguez, Standard Freeholder. Please go ahead.
Good afternoon, Dr. Roumeliotis. Nice to speak to you. It's been a while.
Hi, Hugo.
2 questions for you. First, fatalities. This has been the deadliest wave within Eastern Ontario Health Unit. And you made a comment earlier as to sort of some analysis that's been done of the related fatalities in this wave. But it seems as though there was more anxiety, more worry, more concern in earlier waves that haven't been as deadly as this third one. So I'd be curious to any of your thoughts in terms of...
We are looking, Hugo, that's exactly my question. What is going on? I know that a lot of the deaths were still Delta variant. They're not Omicron. And we're looking at that. I could tell you that the majority of the deaths that we've had multiple underlying conditions, and the majority were either unvaccinated or partially unvaccinated. I will be reanalyzing the data because I had the same concern as you had, Hugo, and we want to look at exactly what happened, why we had that increase. As you said, we're now up to 202. That brings us to about 88 per 100,000. And just to put it into context, it's about 3 more than the average in Ontario. Ontario is about 85 per 100,000, and we were at 88 per 100,000. So I'll be looking at that, and I had the same concern as you did.
Thank you. And secondly, as we move to normalcy, you've already indicated this will be your final regularly scheduled briefing. What can people count on in terms of the any information about the presence of COVID in our communities and how that will be maintained and remain accessible? We will continue
with regularly updating our website with the numbers. I will be doing YouTube and other tweets and other information on our website. We will continually be moving forward. We will continue using the web, our internet and web as much as we can. And again, if there's any change or any need, we will be doing obviously press releases and reconvening, one-offs or restarting. I hope I don't have to restart it, Hugo.
Thank you.
No problem.
Prochaine question, Samuel Blais-Gauthier, Radio-Canada. C'est à vous.
Bonjour, Dr. Paul. Écoutez, vous l'avez évoqué tout à l'heure en anglais, mais j'aimerais vous entendre là-dessus en français, justement sur votre opinion personnelle là, quant à la levée de l'obligation du port du masque là, dans la plupart des lieux publics. Donc, peut-être juste nous dire là, en français ce que vous pensez de tout ça.
Mais je pense que, premièrement, la façon qu'on a fait de façon progressive, je suis très d'accord, et on fait ça étape par étape par étape. La prochaine étape sera de faire une décision de quand enlever le port des masques. Moi, j'aurais voulu avoir une autre quelques semaines ajoutées au lieu de le faire le 21 mars, tout de suite après leur rentrée à l'école. Ils vont rentrer à l'école. Donc, j'ai plusieurs raisons pour ça. La première raison, c'est que ça ne donne pas beaucoup de temps aux écoles. Regarde, demain et vendredi, c'est fini pour une semaine. Donc, ils retournent avec tout normal, tout un nouveau monde, sans avoir beaucoup de temps de se préparer, physiquement et psychologiquement aussi. Deuxièmement, on a encore une positivité qui est un peu élevée et j'ai peur, comme on a vu dans les autres situations, quand on avait une pause de l'école ou pendant les fêtes, etc., le taux de COVID a augmenté parce que les enfants jouent ensemble, etc. Donc, j'aurais aimé d'avoir une autre quelques semaines, de vraiment voir l'effet du congé scolaire qu'on va avoir la semaine prochaine. Et finalement, en mois d'avril, la température commence à être plus doux. On ouvre les fenêtres, on est plus à l'extérieur, donc on a moins chance, le virus a moins chance de se propager. Donc, il y a ces raisons-là, mais en effet, la façon qu'avec l'étape, je suis très d'accord avec ça, je suis très satisfaite, mais moi, mon opinion personnelle, c'était d'attendre un autre quelques semaines pour les raisons que je vous avais mentionnées.
Merci beaucoup.
Thank you, Dr. Paul. Merci. There are currently no more questions in the chat box. If anyone else has questions, please unmute yourself now. Il n'y a pas d'autres questions dans la boîte de clavardage. S'il y a d'autres questions, vous êtes invité à ouvrir votre microphone.
Oui, bonjour, c'est Charles Fontaine, Journal Le Droit. Je me demandais si les deux éclosions en ce moment, c'est quelque chose d'alarmant. Puis si vous pouviez nous dire c'est où les éclosions, est-ce qu'on le sait?
Sont sur nos sites web, je ne sais pas lesquels. On a la liste sur nos sites web, mais j'ai aucune indication que c'est quelque chose d'inquiétant.
Merci.
Pas de problème.
Other questions? D'autres questions? Those are all the questions, Dr. Paul.
Thank you very much. Merci tout le monde.